Hi, everybody. And welcome to this National MS Education and Awareness Month conference hosted by MS Focused Multiple Sclerosis Foundation. I'm your host, Kimani Hendricks, Multimedia Communications Coordinator for the foundation. And today we're joined by Dr. Pearl Werfel, who will be talking about mental health and MS. We will have questions and comments and a little bit of interaction after Dr. Werfel's presentation. So this month, our NSEAM theme is the whole picture, leading a better life with MS, and we aim to provide a holistic approach in managing MS. So each year, MS Focus creates a toolkit that we send out to people who are on our mailing list. And if you are subscribed to MS Focus magazine, then you already are on the mailing list and you'll be receiving the toolkit within a few weeks. However, if anybody is watching that's not on our mailing list and would absolutely love a toolkit, you can reply to the registration confirmation email that you received when you signed up to be part of this event. And then we'll put you on your mailing list, or we'll put you on our mailing list when we get your information. The webinar today and the toolkit is also made possible with support from Genentech, Sanofi, Novartis, and EMD Serono. So now I can finally get into the introduction with Dr. Werfel. So Dr. Werfel is a clinical psychologist in private practice in San Francisco, California, with expertise in management, stress, anxiety, pain mitigation, and multiple sclerosis. Dr. Werfel, we are pleased to have you join us today to present, and I'll turn it over to you. You can start sharing your slides.
And we're just going to hope this goes perfectly right now. Okay. It worked. Hello, everybody. And I'm going to be talking about MS and mental health. And I'm going to get some help if there's some reason that I can't be heard or there's a problem. I have Kamani to let me know. So let's begin. And what I want to do is I want to make this much smaller so I can read my slides. There's little banners all over the place. So I'm going to tell you something that you absolutely know. Living with MS is not easy. It's difficult. And there's no coping skill that I can talk to you about that's going to make it easy. But if we can learn some acceptance and creativity, it can be easier. It can be less painful and less complicated and even more rewarding. So that's what we're going to be doing today. And I'm going to ask you to kind of join me with some curiosity. Tap into your curiosity and maybe even tap into a little bit of your humor, because we're going to be starting with some difficult things and then we'll get more into the creativity, curiosity, and humor. Okay, and for some reason, my slide is now not progressing. Kamani, I have, for some reason, let me try it here. All right, there we go.
Okay.
I apologize.
It's okay.
I pushed 4 different buttons and it progressed. Thank you. So before we begin talking about what I really want to get into talking about, which is coping and creativity, I want to just mention 2 things that it's important to be aware of. Anxiety and depression are very common with multiple sclerosis. And this is a long list, and I just want to make you aware of it. We're not going to be getting into it, but I just want you to take a look at the list, and I will be reading it out for those of you who might have some sight impairment. So if you have excessive worry, fear, or obsessive thoughts, you feel tense or restless or on edge, difficulty concentrating, making decisions, irritability, feeling overwhelmed, feeling that rapid heartbeat or shortness of breath, nausea or stomach upset, difficulty sleeping. This is a real signal, what we call catastrophizing, like turning small things into always believing the worst will happen, and even avoidance of situations that trigger anxiety. Now, We all feel tense sometimes, or restless, or we worry. But if this is getting in the way of your life, this can be a medical diagnosis called anxiety. So it's just important for you to be aware of. I'm going to go on to the next one, which is depression. There are some symptoms of depression: a continuous low mood or sadness. We get sad, something's going on. That's not depression. But if you can't get out of it, feeling hopeless or helpless, having low self esteem, crying or feeling tearful, feeling guilt ridden. And here's that irritability again. Could be depression, could be anxiety, and feeling completely intolerant of others. Having no motivation or interest in things, you're just losing interest and finding it difficult to make decisions. These can all be symptoms of depression. So take a breath, because we're moving past the symptoms of depression and anxiety. And I want to tell you, if you have used the tools in this program or try using them afterwards, and you've tried many different things and you're still struggling, you don't need to continue to struggle. There is help. So first you want to try. Let me try some of these things we're talking about. That's not working. Get some help. For referrals, you can contact your physician, and here's the telephone number and an email address for the Multiple Sclerosis Foundation that can help you with some referrals to get some help. So, one more thing. I know I promised you humor and creativity, but we got to start with the difficult stuff first. I believe everybody is muted. So I'm going to give you an opportunity while you're muted. I'm going to list some typical things I hear that are so challenging about living with MS. And I want to give you an opportunity just to say it out loud with you muted. And you can make a face like this face, or you can just say it, or you can just think it, and we'll just put it out there just so we have it. Discomfort, not knowing from day to day, insurance carriers, dealing with the medical system, not being able to, and that's your fill in the blank, people not understanding and being seen as my diagnosis. And just think about it. Think about these things that might frustrate you about living with MS. And now I'm going to invite you to take some breath. And just like the word stress is written in the sand here, I want you to imagine that all those things that you think about that are so difficult about living with MS, with each breath out, it can just be washed away a little bit. This is not magical thinking that we're washing away MS, but washing away having to hold all that frustration in us, that we can let go of the stress. This is just a technique to imagine it's being washed away by the water, or if all of this was written up on a whiteboard, just being erased as you say, I don't have to think about this right now. I know it exists, but I can take a breath in and out and let it go just for now. And I'm doing this very quickly, and you're welcome to do this at any time during the presentation. Take a breath in, and as you take a breath out, you just let it go a little bit more. So now comes the creativity. How we think about things really influences our ability to live well with MS. New mindset, new results is really what we want to be looking at. So what do I mean by that? Well, let's take a look. I often hear people saying, oh, today was a good day. Oh, today was a bad day. And I want to invite you to think about exiting the good bad paradigm. I think it's helpful for us to let go of that. There will be days when you have more energy or less pain, and days that you feel like you're slogging through mud. But if you let go of the idea that this is a good day and this is a bad day, we can shift our perspective a little bit, because it's what you do with the days that can make a big difference in your overall experience in living with MS. So let's talk about what I mean by that. So what do you do with days when you're moving around easier? Think about it. Do you appreciate that and go, wow, okay, this feels good? And maybe use a little bit of that energy to prepare for a day that you might not have as much energy. Oh, I can get a little something done today. Maybe I can do a little cooking, or maybe I can approach this. Sometimes what people do is they push and overdo. They say, I've got the energy, and they push, 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 and that exhausts them. And that's going to not lead to another day when you're feeling more energy. But what do you do when a day is more challenging? Yes, there will be challenging days. We can be upset, we can cry about it, we can get frustrated. And of course, if we really had something planned that day, it's really frustrating. And you can even feel like giving up or seeing the day as a complete loss. Or you can get more into acceptance and take a breath and use that day to rest up, replenish, and restore. That's the day you take out that book or listen to that audiobook or watch that special movie, listen to that new piece of music you've been wanting to really pay attention to, or spending time just sitting outside or with a pet. However, you can appreciate a more low key day and just breathing and allowing it to happen, because that's acceptance. It's what's happening. So we want to look at creative coping, navigating so we can navigate the challenges of living with MS. Take a look at coping strategies. One of the things that I just talked about was acceptance. Michael J. Fox is here. No, he's not living with MS, but he is living with Parkinson's. And his quote is that acceptance doesn't mean resignation. If you accept that, yes, I have MS, yes, I'm struggling now, it doesn't mean you're giving up. It means understanding that something is what it is, but there is a way through it. There is a way to help yourself if you're not fighting against it or giving up. So sometimes acceptance is important, and we'll get into all of this. Other times, action is important, because action changes things. I love this little slide. Sometimes we need to act. Sometimes we need to do something. We just don't say, okay, this is what's going on. We sometimes say, this is what's going on, and what do we do about it? So let me move to the next piece with this. When we think about coping, really effective coping is characterized by flexibility rather than by the use of specific styles or strategies. So what does that mean? And we'll look at that. We want to look at coping flexibility. We want to be able to recognize when what we're doing is working and when it's not working, and then find a new approach. And it often is through purposeful trial and error. Actually, living with MS is often about trial and error. Let me see what happens. How can this work? And sometimes with medicine also, when we go to the doctors, they're like, well, let's try this. Well, let's see this. It's important to understand culture when we're talking about coping, because the way you cope can be largely influenced by your values, your attitudes, your beliefs, your culture, and also the way you were raised in your family culture. For example, some cultures tend to utilize what's called religious coping, leaning more in religion. Others rely more on individual methods, like I got to do it myself, I got to pull myself up, while some others look towards community and family for support. So it's important for you to look at how you've been influenced. And again, is it working for you? There's many different kinds of coping styles. You do not need to remember these. I will be going over these, but I just want to let you know there's a bunch of different coping styles, and we're going to get into them a little bit more to give you some choices. And here is one: avoidant. We all know about avoidant, but notice how I described it as restorative distraction. It means you're frustrated by something. You're waiting for the doctor to call back. You're waiting for the insurance company to approve something, whatever it is you're waiting for. And there's really nothing you can do in that moment. So you distract yourself. You listen to an audiobook, you go outside and see the flowers, or you view it through the window, you play with a pet, you watch something. That's really healthy coping in that situation. There's nothing really you can do. So let's take my mind off of it. And don't worry about remembering these. I'm going to be going over them several times more. There's another kind, it's called psychological coping. That's what you're doing right now. You're learning about it and also keeping your own journal, talking with a friend or family member, or sharing with the people in this group, speaking with a psychotherapist, joining a support group, meditation. Those are all ways of psychologically coping, dealing with feelings that are coming up. Can be helpful sometimes, other times may not be, and we'll take a look at that. Another one is instrumental or problem focused. This is where I talked about ACT. You see someone is in physical therapy here, if you can see the picture. So what does that mean? Getting exercise or movement might help. Consulting with a physical therapist, a psychotherapist, your physician about something that's coming up, and maybe organizing your life or where you live to make things more accessible to help with fatigue management. This is the way of being problem focused action. Again, take a breath. You don't have to remember these. I'm going to be going through it again. There's another one, meaning focus. And we've all heard this. When life gives you lemon, this is a little bit different. When life gives you lemon, get creative. What am I going to do with this? What am I going to do here? That's when you tap into your creativity and your humor. So you might want to share your experience with someone that's newly diagnosed if you've been living with MS for a while, to share how you got through some difficult times, because by sharing with others, you remember your own abilities. We already talked about low energy days and what you do about that. View some photos. Make use of that to allow you to relax. Like, okay, I've been wanting to check those photos out. Let me just lay here and take a look at them. And finding your unique contribution. You learn a lot living with MS. You have to be strong. You have to be resilient. Who are you? What is your unique contribution? And you have one. So it's so important to find that so you can find some meaning in your life. And then there's the benefit finding, positive reframing. Sometimes things come from living with MS. By learning to live with MS, you may have become more resilient. You may have become more creative. You certainly have become more aware of how to interact with the health system. So learn about that. Maybe you've gotten better at advocating for yourself. But also positive reframing can take place in prayer, or what people call a gratitude practice. of being grateful for what you do have and really highlighting that and let your what you do have get bigger than what you don't have. It's a way of coping. So let's take a look at these. These are a number of different strategies that we just talked about. And as you'll see as I go through it, each one has a helpful part to it and a not so helpful part to it. So the avoidant, remember the distraction. In short term, it can decrease your stress. It can be helpful with acute symptoms. You're just really uncomfortable distracting yourself can be helpful. But if you're using avoidance a lot, and I think you know when you are, it prevents you from being able to problem solve. And it doesn't change the situation. Unfortunately, if you rely too much on avoidance as a coping technique, it will actually increase your anxiety. I know, not fair, but it does. Because in the back of your mind, you still know you have to do something about it. We talked about psychological coping, exploring feelings and emoting and reframing. Well, how does that help? It allows for acceptance. Once we've cried over something or been angry about it, we can take a breath and say, okay, I need to accept that this is happening. And you become more able to adjust to challenges. But for some people, if they stay focused on what is difficult with MS, and some people do a lot of that, they're journaling and they're just writing down or they're just thinking about, oh, this is so difficult. If you're not taking that breath and coming out of it, it can lead to a sense of helplessness. And again, you're not looking at problem solving. So there has to be a balance of having your feelings and then being able to bring some comfort to yourself. The instrumental or the problem focus. I know a lot of people like to do this. Okay, what can I do about it next? What can I do about it next? It's about problem solving, taking action, doing something different. It may address the issue that you're dealing with and increase your mastery and definitely your self-efficacy. So it can feel really good when you find that workaround or that, make it to the right person that can help you with whatever is going on. However, it can also increase helplessness. If you're pushing through and pushing through and pushing through and not really addressing any emotional distress, it keeps you in that fear place. And that especially happens, I've seen people that are newly diagnosed that are like, I changed my diet, I'm doing this exercise, I'm seeing this person, I'm getting acupuncture, I'm doing this. It's great, but there's a forced feeling to it. There's a push to it. There's that fear if I stop, it's all going to fall apart. So, what has to happen is the person needs to address the fear and go and participate in all these things that may be helpful in a less pushed way because it's very exhausting. And it ends up doubling back and making people even more upset. So let's look at some others. Meaning focus. We talked about finding life's lesson, making lemonade. Meaning focus can really strengthen relationships. Personal and spiritual growth can happen if you really look at what meaning can I get from this? What can I learn from this experience? Not this is happening to me because, but is there anything I can get from this experience? Can I squeeze it and learn just a little bit? The downside, if there is something called toxic positivity, which I love, which is forcing yourself to always see the silver lining, the bright side. It's not being true to yourself. And what happens is you're denying how much you're struggling. So there's a balance, and it can prevent action. So sometimes it can be really helpful, but sometimes we can be forcing ourselves to feel positive when we're not feeling that way. And we need to be honest about what's going on with us. And the last one is benefit finding, that positive reframing. Again, prayer can be part of that, and reorganizing priorities, meditation can be part of that. It can increase our acceptance. It can decrease distress, definitely. But again, it's the same as meaning focus. It can also prevent action if you need to take some action. You need to get to that physical therapist. Finding a benefit of what's going on is not going to help you get stronger physically. Okay, so I've talked about the positives and negatives about all these different ways of coping. How are you going to know if it's helpful? There is one thing you can ask yourself. After you've engaged in any of these coping trends, ways of coping, whether it's avoidance or dealing with your feelings or instrumental, do you feel better psychologically? Do you feel stronger? Do you feel like I have more of a handle on it? I think I know what I'm doing. I have more information. Has your perspective changed? Are you feeling less like, oh my goodness, it's all falling apart, and more like, okay, I have some tools. They may be teeny tiny tools, but I have some tools. Is life just a little easier? If that's happening, then the way you're using the coping is working for you. But do you feel about the same or worse? Okay, I've watched 3 hours of whatever it is on binge watching, and I don't feel any better. I just took my mind off of it, but I still feel pretty bad. Do you feel more stuck or more anxious? And I described how that can happen with pushing yourself into something or leaving yourself in pain and not helping yourself rise in any way. And does it feel like you need it more and more? I need to I need to go and do more hours of meditation. I need to find another therapist. There's that push, 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 push. Whatever you're doing may not feel helpful if there's a desperation to it. And people think, well, what's the big deal if I need to meditate more and more hours? Because meditation can calm you, but then it can become avoidant. And we always need to have that balance. So important to have the balance. So I'm going to talk one more minute about coping flexibility. We come back to this of what's most effective for people that are living with challenges like MS. It's the ability to recognize when what we're doing is not working and find a new approach. Also, it's the ability to recognize what is working and say, congratulations, yay, me. So it's either saying, mm-mm, or it's working a little, but not as much as I want it to work, or it used to work, but it's not working right now. And through trial and error, experimentation, creativity, finding what works for you. This is how you can help yourself with some of the stressors, even if you're living with anxiety or depression and you're getting medication or help from a psychotherapist or both. Your coping can even help you feel better. So I'm going to talk about, again, those coping styles. Yes, you've seen the slide before. The instrumental, that's action, I'm doing something. The avoidant, pretty self-explanatory. finding some kind of meaning in it, making lemonade, benefit finding. What is the benefit of this? So, what is the benefit of not having as much energy in a day? The benefit is, okay, good excuse for me to have a chance to read or watch something and not have to do as much. And the psychological, the acceptance and reframing. Now, why am I telling you this again? Because I'm going to be asking you to do something. And this is what I'm going to be asking you to do. I want you right now to take a few minutes to think about the different coping styles we've discussed, and I want you to evaluate. I'll put them back up on the screen again. You don't have to memorize these. Have you tried this type of coping skill? Are you overutilizing it? Are you leaning on it too much and it's not really being very effective? Are some ways of coping not as effective for you at all? And then I would really like to hear what one new way of coping would you like to try? So I'm going to go back and take a look at, if it'll let me go back. Oh, now my computer is allowing me to go back. I am rejoicing. I'm going to go back for a minute just to review for you so you can begin to think about this and take some time. And then we're going to talk about it because I went through these quickly. So I'm going to go back again and just let you look at them one more time. And as you're looking at them this time, I want you to think about, what do you use and what is working for you? And if you want to, you can make notes of this because we'll be talking about this. So the avoidant, the distraction, the psychological, exploring feelings, however you do that. Journal, sharing it with a group of others, sharing it with one other, sharing it with a professional. Instrumental problem solving, taking an action. I'm having this problem. What can I do about it? How can I make my life easier? I might not be able to change everything I want with MS, but can I make it just a little easier? Can I find a way to be just a little more comfortable? And then a little more comfortable after that. Meaning, finding life's lessons, making lemonade out of the lemons. Remember, it can really help, but it can also turn on you if you're in denial how much you're really struggling. And the idea here is not to struggle. The idea here is to find a way to make living with MS just a little easier for you. Helps us feel stronger. And the benefit finding, that positive reframing. People will say, now that from living with MS, it stopped me. I was all about my work. And now I've really taken a breath and seen other things that are so much more important. Or I changed the way that I approach my relationships. Some people allowed themselves to let go of really bad relationships, or change the way they approach work. That's a benefit. But again, if you're always looking for the benefit, you may be denying how much that you're really struggling. So I'm going to put these back up here. And remember, I'm asking you to take a few minutes, think about the different coping styles, and evaluate for yourself. Have you tried it? Are you overutilizing it? Are they not as effective for you? Or what's really effective for you? And then I'm going to challenge you. I want you to think of one new way of coping, a new way of coping that you would like to try. This is where I asked you to kind of be creative, trying a new way. Think about this, and then I'm going to have you put this in the chat. And then we'll go through, Gamani will help us with what was in the chat, and then we'll have some time for questions and further exploration. So for just a moment, I'm going to go back to the coping, names of the coping skills, and remember you're thinking of one new way of coping that you would like to try. I'm putting that in the chat. So I'm going to go back, give you a couple of minutes to think about this. Not important that you know the names of the coping styles, it's just the way to help categorize them. Think about what you'd like to try and share it with us, please. And note for yourself which ones maybe you're using more than they're helpful, or which ones are really helpful to you. Just going to give you another couple of minutes to have a chance to do this. Letting us know in the chat what you'd like to try. And then any questions that you have, we will get to those also. Giving us plenty of time to interact with each other and really think about this. I know you thought you'd just be sitting and listening, and I'm asking you to work. You don't have to. I'm just inviting you to. So one more time, thinking about what coping styles you tend to use and if they're working for you, and then sharing with us what one new one that you haven't tried or haven't tried in a long time, haven't used in a long time, you would like to try, and put that in the chat. Okay, what I'm going to do now is I'm going to stop sharing so that we can talk. And let's see where we are here.
So the
Hi.
chat is moving pretty quickly, and I'm glad for that because we have a nice number of people and it's good to see that interaction. So, the first thing that I saw, I think, was from, well, I won't say her name, but prayer
And what
med.
I just wanted to ask you, you probably might get questions in there, but let's do the type of coping. And then if it's not too much trouble, then we can go back to the questions. Does that work?
Yeah, I was
Thank
reading
you.
off the strategy. Someone says prayer and meditation always helps. Another one says they're definitely meaning focused. He says, I've gotten tons of lemons that I can turn into lemonade. Nice. Another attendee says they use a lot of problem solving, mostly on their own. Sometimes reaching to see how others handle similar challenges. I want to pray and meditate more, they say. Another one is making lemonade from their lemons, benefit finding, asking others how they cope help someone else. Let's see. Someone says they would like to find more meaning in their daily actions. Most of it is okay, but they sort of bounce around and, you know, so I hope you can find that direction. Always pray before you try to figure it out. That's a good suggestion. Definitely one that I can co-sign. I think others in the room can as well. Someone says
And
they,
I wanted to say something to that. I love that, to stop. And
yeah.
if you're not doing it in a panic, you're just stopping and you're saying, okay, what do I need right now? You will often be making a better decision than going for something in a panic. Thank you. Wanted to underscore that.
Yeah, for sure. Someone says they listen to music to relax. Uh, Definitely a universal language. We all love music. Someone says that they would like to benefit from more downtime away from work. So that work-life balance is in need. Someone says they've used all to a greater or lesser extent. They said the one that they really want to expand on is psychological growth, connecting to individuals who also have MS and is looking for support groups. So that's good. Music, another one. Meaning focus is what I get used to or what I got used to through college. I was diagnosed early in those years. I decided that I was going to graduate no matter what. And that's what they did. Hey. Mm. A lot of people are saying that they kind of do a little bit of everything, that it just blends. They cope by talking to others who have MS, as far away as the UK. Nice. Um, Last fall, problem solved ways to get up, but crawled to stairs and could stand up. Hmm. Music,
So
music.
that problem solving, I just want to put out, physical therapists can really help you find safe ways to get up from a fall. So you may go to a physical therapist and they might say, okay, get down on the ground and we're going to show you how to get up. So if you're really struggling with that, you don't have to go to 100 appointments. You can go to one or two and get that help. Thank you.
Another person says psychological acceptance works for them. Uh, Someone else says rewarding myself after a big struggle and then having a breakthrough. It's like I took a hot air balloon ride. I think so
Oh,
lucky.
I want to ask another question. I love that. So people can put in the chat, how do you reward yourself in healthy ways?
Ooh, it's good. Yeah,
Let's find out how people reward themselves. Yay.
I am dying to go in a hot air balloon. So you are very lucky. Laughing. Ooh, yes. Laughter, good medicine. My gosh, so many. I'm trying to like make sure I don't miss any. And that's hard when the
We
chat.
have plenty of time. I allowed us plenty of time. So
Okay, good.
take a breath. You don't have to talk fast.
let's see. Did I miss where are we at? Where are we? Where are we? We are praying. Um, someone else says that prayer helps them keep their mind in a positive state. Someone says looking at old pictures, reminiscing, physical and spiritual therapy. Uh, oh, this is the one that I missed. Okay, so someone says what's been helpful is a new exercise program and being involved in more support groups. I also like being in control of food intake and diet and find positive results from my pain. That's good. Um, Physical therapy has really helped me. I'm now walking with a roller walker.
Mm.
My rewards, this is probably my favorite. Someone says they reward themselves with ice cream. Love it. Someone else says getting on the ground and showing me how to get up is exactly what I asked my PT to do today, and it helped my anxiety about falling.
Wonderful. Talk about problem focus, instrumental. Congratulations.
Yeah. And I think that's all in the chat, but I do see a question or two in the Q&A, so we'll just jump in there.
Sure, thank you.
Someone asks, does a PEMF mat help? And have you ever heard of it?
I haven't, but let's find out. We have a whole group there.
Okay. Let's see.
I would need someone to tell me what it is. I'm assuming it has something to do with physical therapy and movement.
Let's see. Um,
Let's see if we can find out what it is.
Someone says, or on the internet, it says it causes increased blood flow to the site of an injury by dilating the blood vessels that deliver oxygen to the damaged tissues. Hmm.
Okay, so I would suppose someone would speak with the PT or with the physician about that. I'm not familiar with that. Or maybe a chiropractor. I don't, yeah. Always learn something new here.
Yeah, I think that yeah, I've honestly never even heard of that. Now I'm curious. I have to do a little bit more research. But yeah, never heard of that either. Um, Someone in the Q&A says they says, I'm trying to deal with my MS right now. My husband was involved in a hit and run 4 months ago. I'm trying to hold everything together and make sure that I'm doing everything for him as well. So that's something that I guess you can talk about a little about how to balance that self-care on a mental, emotional, and spiritual level and trying to take care of others.
Yes. So, to that person, you are a caregiver, and I am really sorry. That's just a difficult thing that you're dealing with. Don't want to scare you, but I need to let you know that caregivers tend to have more psychological difficulty in the long run than the person that's actually receiving the care because there's that constant, I need to be on top of it. I need to take care of this. It is, and many people are caregivers in different ways. Like they may be parents, or they may be teachers or nurses, or, have family members that need their support. So there is that balance. And in the beginning, so recent for this person, it's going to be more in that, what do we do now? But then asking you to make sure you get support, a group for other people that may be going through this, and they're often through rehabilitation centers. There are free groups, and there's a lot of them are online right now. So you have like a whole country to tap into. Or asking for a trusted friend you can talk to and recognizing people feel so guilty. How can I take time for myself when this person is struggling so much? My MS isn't as bad as this person. And I can tell you, I had to learn this when I had to take care of my mother, and I'm living with MS. And she descended very, very quickly into Alzheimer's from some medication she was taking and went right into dementia. And I had to look at, how do I balance this? My MS is not as bad as her sudden onset, struggle. But you have to learn, and you have to allow yourself to say, I need to take care of myself because I need to be as healthy as possible. You will not be available for someone else if you're not taking care of yourself. And I know that sounds easy. It's not. It's figuring it out day to day where the balance is. Like I was purely into caregiver mode today, tomorrow I really need to give myself something restorative. What do I need? Making sure you're getting some movement and making sure we want to eat junk food when we're stressed, and it's the worst thing for us. So making sure you're having some treats, not in denial, but also something that's going to nourish your body.
Yeah, I think talking about the unhealthy ways that people cope is just as important because, people are just looking for any kind of relief, even if it is temporary. They're like,
Hmm.
I'll take temporary over a full day of this, but that can be deleterious to their health in the long run in every way, shape, or form. So thank you for touching on that.
So I am all for, look, during the pandemic, we didn't even have the word binge watch until the pandemic happened. Well, I was all for it. I was telling my clients, find some good movies and just, there's nothing we can do about this right now.
Yeah.
And there wasn't. It's just that was an opportunity to take your mind off of it. Do whatever you can to take your mind off of it.
Mhm.
If there really isn't anything else you can do, you just need to take your mind off of it. Or if you're just exhausted, you just take your mind off of it. But yes, we can't hide with that.
Yeah.
And it's always a balance. The ice cream is great as a treat. If you're grabbing that ice cream often, not helping your body. So it's
Mhm.
all about that balance. So thank you. Other
Um,
other questions or comments?
yeah, some people are throwing their strategies and what they use. I'm seeing a lot of prayer has helped. Um, let's see.
I want
Keeping
to
a
say
positive
something about prayer
mindset
for a
as well.
moment.
Sure.
There's a huge definition of prayer. And
Mhm.
some people think to pray you have to be religious. Meditation is a form of prayer, saying, I can't handle this. I'm willing to let go of this. I need help without having any idea why you're saying that, who you're saying it to. So you might be very religious and that might be helping you. But if you're not, it doesn't mean that you can't have that benefit.
Exactly, because it's always the relationship. It's never the sorry, my mother's calling. It's never about that. It's just about the relationship with the higher power, really. So you can even it's and honesty too. Like I I think that prayer is conversational on the one end because it's like you have your moment to say whatever and then you have to also listen. So I think that right there is would be meditation in terms of what
Hmm.
earlier. Yeah. So it's talking, but also opening yourself up to listen. So closing this, but open up the rest of that.
And an example of that sometimes is just saying, please help me. You don't need to know who you're saying it to, what you're saying it to. You don't have to imagine. And then stopping and hearing and observing, because the answer sometimes comes to us when we're not grasping for it, but we're in the receiving place. Yes.
Yeah, and then too, you can be like, I have no idea what I'm doing. I'm not structured. I didn't grow up in this or whatever, but you know what I'm saying. And
Doesn't matter.
and they definitely will if your heart is sincere. They will.
And there are many people that don't believe in having a higher power, and that doesn't mean you can't say, I can't deal with this. I need some answers.
Right.
And you know, the answers comes. A friend calls you and says something, you're like, you gotta be kidding. I was just thinking about that. Because we listen, we open our ears and we open our heart and we open our minds, and the answers do come. And we don't need to worry about where they come from. So
Right.
let's move on to some of our other rewards and comments.
Um, Someone else said ice cream as well. Uh, let's see. Someone mentioned a class. Someone says Aging Ahead has a better balance class free on Zoom. They teach how to get up after a fall. My chiropractor uses the mat that we mentioned earlier. They said that they've used it a few times with their chiropractor. So aging
Oh,
ahead,
can
better.
you put that, is that link in the chat? The
The person just put the name of it. They didn't put a link. If you can drop the link to where they can actually access the class, that would be awesome. But it's called
Thank you.
Aging Ahead and it's Better Balance class and it's on Zoom. Good to know. Let's see. I always think about my MS. I always think about how my MS has gotten to this point where my balance and coordination is so bad, but I always remember that it could be worse. Mhm.
Hard to keep that in mind.
Yeah.
Really hard.
So much of mental health struggles I think are easier said than done. Um, I have a history of it myself and still kind of grapple with things, but I am managing better, thank God. But when it's bad, it's horrific. And I've been one of those people, and I don't know how often it happens, but I think that because physical health is aligned with mental health and that your mental health does affect the physical. I've been so depressed at times where it's like I can't even function. And I think that's probably the most rock bottom moment, being so low that it's like you can't even move. And I don't even know really how I came out of that because it was bad. It was bad.
So when that happens, and I'm sorry that you've had that struggle, that's what I talked about earlier. There are people out there that can help. And there are insurance companies and Medicare and Medi-Cal. Yes, you have to pound on them and pound on them and pound on them. I'm talking about the insurance companies. But there are people that are out there to help. And there are also free resources online. There's free support groups also. There's a lot of help for it. So that's important. There's resources through the Multiple Sclerosis Foundation, but also the MS Society often has even classes about what do you do about depression. And if it's really bad, also, talking to a physician and getting even some short-term medication. So there's that idea that you don't have to struggle that hard, that there's help. I know it may not be easy to get it, and you might have to wait, but there is help. So we have a couple more minutes just for, oh, I guess we have like 2 more minutes. Any last questions?
I see comments in the Q&A about eating better and how that
Hmm.
helps. Someone said at age 50 they recently received their MS diagnosis and they don't have any symptoms as of now, but being here and listening to you has been helpful. So they're saying thank you.
Good.
Someone asks, does a treadmill help with balance? Good question.
That would be a really good question to ask a physical therapist, or even there's some physical therapists that consult with the Multiple Sclerosis Foundation, so that maybe you can get some kind of answer.
I will reach out. Well, I know we have Dr. Karpatkin, Herb Karpatkin,
Yes.
work, who does conferences for us from time to time. That's a good question. I'll have to ask him that the next time I talk to him. We do have one more in the Q&A. Someone says, I have diligently tried each of the coping strategies mentioned, but my best strategy after being diagnosed with MS 31 years ago is to smoke marijuana. They said it's not avoidance, just a great timeout and affords me pain relief and the ability to sleep through the night. This is healthy for me. That's it.
So if you're utilizing it as medicine, helping you with pain, helping you sleep through the night, if you are stoned most of the time, you need to wonder about participating in the world. So, as with anything, it can be great medicine, but it can also be a problem. Just like with the ice cream, can be great medicine or it can be a problem. So thank you.
Don't see
So
anything
I
else, and we're right at the hour,
And
so
we are right at time. So I want to thank you all. Not seeing any of you. It's so weird to do this to a computer, but I want to thank you all for being here and being willing to be open and giving us so many great suggestions that other people are hearing and saying, "Oh, I'm going to try that too." So
yeah.
thank you.
Thank you, guys. So that does bring us to the end of the conference. If you did miss any of it, we have it on our Facebook page. After we close out here on Zoom, you can go back there and watch it on the live stream that's recording from there. In a couple of weeks, it will also be on our YouTube channel. So if you're not subscribed to that, just go to youtube.com and type in Multiple Sclerosis Foundation and you'll see us. Our next conference is this coming Tuesday. No, not this Tuesday, I think. Next Tuesday? Wait, what day is that? No, what is that? Not Tuesday, Thursday. Like that's not tomorrow's date at all. So at 4 p.m. Eastern time on the 27th, we'll have Dr. Philip Rumrell Jr. talking about MS in the workplace. So that should be good. We would like to also again thank our sponsors, Genentech, Novartis, EMD Serrano, and Sanofi for making this conference possible. And Dr. Werfel, we thank you so much for sharing your time with us in this education. It's always a joy.
Thank you.
Thank you, guys. Have a good night, everybody. Take care.